And the process is different in that in the old days we'd write a letter to the hospital for a patient to be seen in the clinic. Now what we do is the letter as well as some pre-referral guidance. This is a simple A4 page. It's really an aid memoir to remind myself that I've done all the simple tests that the consultant would need to make an assessment. So we then put that together with the electronic version of the results. So I may have done some blood tests, some ultrasounds. That's all attached at the bottom. And then with the All project, the consultant then looks at all this information within 3 days. So what we get is within the 3 days, we get an opinion from the consultant. And that may be one of 3 courses of action. The first one may be, okay, I feel this patient needs to be seen in the clinic as usual. But the second one may be this community clinic, and the third one may be, well actually John, you might like to try this treatment, and this is the way a management plan essentially might unfold, a way I could look after someone in the community where it wasn't actually necessary for them to go to the hospital at all. So we're sort of making the most of the hospital expertise through the consultants. We're actually making the most of the GPs, and they're supported and are able to look after patients more effectively in the community. And patients, of course, don't have to go to hospital and waste time, taking time off work or having to get a relative to take them up and all that cost of the parking. So we're really making it's best for everyone. So we're at the point now where you've had this problem with your nose for some months. Yes. And we've tried these various treatments and they haven't really worked very well. So I think now we need to get the opinion and the support of an expert consultant in Ipswich. So what I was going to do was I was going to write to one of the consultants there, tell him all about your case, what we've tried, and all the results and the tests that we've done here, and then see if he feels he needs to see you in hospital or whether he can give us some advice as to how best we could manage you with maybe something else I haven't thought about that would be worth trying to save you going up unnecessarily. So I'll write to him and then he'll be in touch with us, and we could arrange to meet up in about a week. He's got to reply within 3 days, so then we'll know what his answer is, and then we can decide whether we try a new treatment or whether we get you're seen at the clinic. Does that seem all right?
That's fine, Doctor, thank you.
Okay then. So here's a letter to Mr. Andreas Hilger, consultant ENT surgeon at Ipswich Hospital, about Mr. Paul Smith of Kelsale. Dear Andreas, I'd be grateful for your help with this 80-year-old man. Well, the key benefits affect all 3 parties in this. So firstly, there's the GP, and I think because we're actually using the pre-referral guidance, we're a bit more thoughtful of what we're doing. We're not omitting things by mistake in a hurry. So we're actually making sure the referrals are better. We're including everything that's appropriate. So that's one good thing. From the consultant's point of view, he or she has a chance to actually assess the case before the patient arrives in the clinic. They're looking at what I've said, they're looking at all the results that have been sent in and thinking, well, actually we could try this or this could be done first. And so they're actually making the best use of their time in clinic. And thirdly, for the patient, of course, the patients are going up to the hospital if they need to go. They're not going unnecessarily to see, maybe a junior doctor to have a few things done and then to come back to the clinic. So we're making, I think all parties are gaining out of this, but mostly it's using all the resources we have at our disposal more efficiently, which of course for the NHS is so important.
It's a very, very good surgery and you get the greatest care. So frankly, I'm very happy with them.